turn on captions for taking notes. Hi guys, it's me back after long time. Actually I had exams so couldn't post. So today I will talk about spinal nerve and brachial plexus. A spinal nerve is a mixed nerve, which carries motor, sensory, and autonomic signals between the spinal cord and the body. In the human body there are 31 pairs of spinal nerves, one on each side of the vertebral column. These are grouped into the corresponding cervical, thoracic, lumbar, sacral and coccygeal regions of the spine. 1. There are 8 pairs of cervical nerves, 12 pairs of thoracic nerves, 5 pairs of lumbar nerves, 5 pairs of sacral nerves, and 1 pair of coccygeal nerves. The spinal nerves are part of the peripheral nervous system. The dorsal root is the afferent sensory root and carries sensory information to the brain. The ventral root is the efferent motor root and carries motor information from the brain. The spinal nerve emerges from the spinal column through an opening, intervertebral foramen, between adjacent vertebrae. This is true for all spinal nerves except for the first spinal nerve pair, C1, which emerges between the occipital bone and the atlas, the first vertebra. Thus the cervical nerves are numbered by the vertebra below, except spinal nerve C8, which exists below vertebra C7 and above vertebra T1. The thoracic, lumbar, and sacral nerves are then numbered by the vertebra above. In the case of a lumbarized S1 vertebra, also known as L6, or a sacralized L5 vertebra, the nerves are typically still counted to L5 and the next nerve is S1. Now let us talk about brachial plexus. I recommend you to take notes, otherwise this will not be helpful. The brachial plexus originates from the anterior rummy of spinal nerve C5, T1, which form the roots of the brachial plexus. The brachial plexus is divided into 5 roots, 3 trunks, 6 divisions, 3 anterior and 3 posterior, 3 cords, and 5 branches. The brachial plexus emerges at 5 different levels, C5, C6, C7, C8, and T1. C5 and C6 merge to establish the upper trunk, C7 continuously forms the middle trunk, and C8 and T1 merge to establish the lower trunk. These roots merge to form the trunks. Superior, or upper, C5, C6. Middle, C7. Inferior, or lower, C8, T1. Each trunk then splits in 2, to form 6 divisions. Anterior divisions of the upper, middle, and lower trunks. Posterior divisions of the upper, middle, and lower trunks. When observing the body in the anatomical position, the anterior divisions are superficial to the posterior divisions. As you can see in this diagram, I have summarized all important points regarding brachial plexus. Let us start from the right side, pay very close attention. Division of brachial plexus, remember to drink cold beer. How funny! On the left side, I have listed all the lesions associated with brachial plexus. Ubb's palsy, waiter's tip, injury to upper trunk. Clunker palsy, claw hand, lower trunk injury. Wrist drop, posterior cord injury. Winged scapula, long thoracic nerve injury. Deltoid paralysis, axillary nerve injury. Saturday night palsy, radial nerve injury. Difficulty flexing elbow, variable sensory loss, musculocutaneous nerve injury. Decreased thumb function, hand of benediction, median nerve injury. Intrinsic muscles of hand, claw hand, ulnar nerve injury. I have got a question for you all. Which of the following nerve is involved in the given condition? Dorsal scapular nerve. Long thoracic nerve. Suprascapular nerve. Subscapular nerve. I have explained this topic just 5 minutes ago. I will post the answer in my community. Until then, thank you for watching.